If you're on Medicare, there's one really important document to be looking out for during the months of September or early October, and that is your annual notice of changes. This comes along with Medicare Part D as well as Medicare Advantage. So in this video, I want to talk about what this massive document is, why it matters, and what to look out for. I'm Emily with the Medicare Coach, an independent fee-based Medicare consultant, helping our clients easily navigate all the government rules, but also the insurance company options to help them do what's right and best for them to protect their healthcare rights and retirement savings. So if you would like more inside tips when it comes to Medicare, click the link below for extra resources, including my free online Medicare workshop. So you're going to be receiving, or you already did receive, your annual notice of change for your Medicare Part D or your Medicare Advantage plan. As a summary, or as a kind of a highlight here, you will not get one of these changes for your Medigap, which is also called Medicare supplements, because the Medigap plans don't really have the same changes every year. Medigap plans work directly alongside Medicare Part A and B, and so they don't have to have these big disclosures because it doesn't really apply to them necessarily. So if you're on a Medicare Part D or your Medicare Advantage plan, you will be receiving this document in the mail around all of the changes happening to your current plan in the upcoming year. It's important to take a look at this document because you can see what's changing. Are the premiums going up or down? Are your pharmacies going to standard or preferred or not covered at all? Are your medications still covered? What tier are your medication covered on? Is it going up a tier or down a tier? What are those copays for those medications? Are there new prior authorizations or step therapy requirements? Things like that are important to be aware of. I oftentimes hear people say, Emily, I don't want to change my plan this year because it's worked so far, I'm good to go, right? And my doctors are the same, my medications are the same, all those things. And I say, that is fantastic that your doctors and meds are the same, but your Part D or Advantage plan are changing. They're changing on you, whether you like it or not. And so I think it's really important to be aware of the changes that are coming up to your plan so that you can be opportunistic, strategic, and find the best plan for you for the upcoming year. So if you're on a Medicare Part D drug plan, as I covered, there are a couple things to be looking at: the monthly premium, the deductible, your pharmacy and whether it's preferred, standard, or out of network, your copays for your medications, which is related to the tier that you're in, things like that, prior authorization, step therapy. Okay, so that's kind of the focus for your Medicare Part D drug plan. See what's changing so you're not going to have any surprises in January, or you have the chance to go to a new plan to ultimately save you money. Now, if you're on Medicare Advantage, you want to look at all those Part D things I just talked about. But I also want you to make note of a few other things. When it comes to Medicare Advantage, there can be different deductibles for the drug coverage as well as the non-drug coverage, like your doctors and things like that. So pay attention to the deductible of your overall plan. Look at the maximum out-of-pocket for that plan. Look to see about what the copays are for your in-network or out-of-network available, doctor's appointments, x-rays, ambulance, ER visits, all of those things. Look at any other details in there that have changed rules around what they will or will not cover. So Advantage plans will have the same Part D or drug coverage kind of analysis, but you're going to have more things to take a look at because of the fact that your Advantage plan just covers more. Also look to see if there's any changes to what your doctor is accepting for your Medicare Advantage plan. Doctors can opt in or opt out of Medicare Advantage, and so please be aware of what those changes are to, again, avoid surprises in the future. So please look out for this important document. Be aware of it. I still recommend, though, that you're reviewing all the other options out there as well to see if there's a better plan for you for the upcoming year. It's so important to be thoughtful and thorough with your Medicare research. For most of you, this is kind of the main time for you to change your Medicare Part D or your Medicare Advantage plans. And the beautiful thing is that everyone can change these plans no matter what your pre-existing health conditions are. So please be thoughtful, use this time wisely, and make your right Medicare decision for the upcoming year. I'm Emily with the Medicare Coach, and we look forward to helping you easily make your right Medicare decision.